So a lot of parents have questions about vaccines for kids under the age of 5.
Yeah, this comes as the Food and Drug Administration expanded the emergency use authorizations for Moderna and Pfizer's vaccines for younger children. So here now to share her insight, we have Dr. Christina Johns, who is a pediatric emergency care physician and senior medical advisor at PM Pediatric Care. Dr. Johns, thank you for joining us this morning. What's your first thought on this? Are you excited for children to be able to receive the vaccine?
I am very pleased. The whole pediatric community has been waiting for this for a very long time. You know, we need to protect every single member of our population, and our very youngest citizens certainly deserve that as well.
So I know there's a lot of hesitancy, especially because they don't, the dosages obviously are different. How would you kind of quash some of those fears of parents that are hesitant about giving this vaccine?
You know, I think first and foremost, what I would say to parents is make sure that you discuss your individual situation with your child's pediatric healthcare professional. That is that's the person who knows the information and knows your child and your family situation. And they are the person who's best equipped to give you guidance. That being said, I know that a lot of people are asking me, well, hey, does my young child even need this vaccine? And I would say, yes, lean into the science. Recall that in the last year, COVID-19 infection has been a top 10 leading cause of death in children. You know, children aren't supposed to die, and we need to do everything that we can to protect them. So number one, these vaccines have been shown to be very effective protecting against severe illness and death. But that's not the only metric. We want to try to make sure that younger kids don't wind up with long COVID symptoms. We want to make sure they don't end up in the hospital, and we want to make sure that they aren't agents in transmitting this virus to other vulnerable people. So it really is important to include them for many reasons. The vaccines are safe. They have been very, very safe in the younger kids. You know, I always say kids tend to tolerate things better than adults, and here is yet another situation where that's being true.
Dr. Johns, is this something where I should wait? My daughter's 9 months, where you wait to the next appointment with the pediatrician? I think we go out 1 year and ask then, or are these being given at pharmacies, or where do you even go to get this vaccine?
Great question. If you go to I would definitely call your pediatrician office. The state and local departments of health are distributing the vaccine, and so different offices are getting it at different times. So I would encourage everyone to call their pediatric office and find out what the guidance is exactly in their community. There are some pharmacies, some urgent care offices who are offering the vaccine for the youngest children. I really encourage everyone, start out with your pediatric office, and they can give you the best guidance.
I know one question that parents have, and even us as adults have had for ourselves, but if a child has already had COVID-19, should they get the vaccine? Is it going to be as effective?
Excellent question. We do know that hybrid immunity, so that means immunity acquired from infection plus immunity acquired from the vaccine, is really very, very effective. The durability or the length of protection after immunity from infection is really variable, and in terms of durability, so length of time of protection and strength of protection or robustness. So I definitely say it makes sense to get the vaccine. Now, the timing of that after an infection, that is a conversation that should be had with everyone's healthcare professional, but definitely makes sense to get it even if a child has had COVID-19 infection.
Is there a difference in like the younger age? My sister has a daughter who's almost 5, and I was like, 5 seems so different than a 1-year-old to me. Is it okay for everyone?
It is okay for everyone. Remember that our immune systems really are working right from the day that we are born, and we build our immunity, but that's because our immune systems that we have inside our bodies work. And so it really does make sense for us. We give lots of other immunizations in the same spirit to our youngest children, and so it makes sense to do.
Yeah, it's so hard though. I mean, it's just like, that your precious little baby, you don't want to put anything in them, but you also don't want them to get COVID.
You want them to be protected. Dr. Johns, thank you so very much for answering so many of our questions this morning. We appreciate it.
Thanks for having me.
Absolutely. All right. Hope you all got some great answers at home. You too, Ellen, as a mom.